Anyone watching this, my name is Gilbert Andry, and I'm a second-year medical student at the Louisiana Health Sciences Center in New Orleans, and I will be presenting our abstract about pre-hospital needle decompressions. So here's the poster that I made for our abstract. I'll be going through each one of these different sections individually. So pre-hospital needle decompression is treatment for tension pneumothorax identified by pre-hospital or emergency service personnel. It diagnosis of tension pneumothorax relies on clinical suspicion, and a pre-hospital needle decompression is not without risk. Patients who receive a pre-hospital needle decompression are also likely to receive a tube thoracostomy in the hospital, which also carries additional risks. In 2016, there was a change in EMS protocol that no longer required verbal orders from EMS providers to perform a pre-hospital needle decompression on patients. And the aim of this study was to determine the incidence of complications when patients receive pre-hospital needle decompressions inappropriately. So methods, it was a retrospective single-center chart review, was performed on all trauma patients undergoing pre-hospital needle decompression from 2016 through 2022 at an urban level 1 trauma center. The charts of patients who received pre-hospital needle decompressions lacked at least one clinical criteria for pre-hospital needle decompressions per state EMS protocol were reviewed. Patient demographics, procedures, complications, and clinical outcomes, including length of stay, were recorded. These are the pre-hospital. On your right is the pre-hospital criteria. And we tracked the patients who did not meet at least one. So our results, a total of 273 patients underwent pre-hospital needle decompression with pre-hospital cardiac arrests accounting for 157 of them. A total of 114 patients were included, and we identified 87 who did not meet at least one criteria for pre-hospital needle decompression. In other words, they were given a pre-hospital needle decompression inappropriately. The majority of patients in this cohort required a chest tube, and 28.6% may have had iatrogenic pneumothorax from pre-hospital needle decompression. Approximately 5.7% of patients were admitted as a consequence of pneumothorax caused by the pre-hospital needle decompression, with an average length of stay of 2.8 days, plus or minus 1.3 cohort. And additionally, we found there were 3 vascular injuries in this population due to pre-hospital needle decompression that required emergency operative repair. Our conclusion in this study was just to show the negative consequences of pre-hospital needle decompression when they were performed without clear indications. Several patients underwent unnecessary procedures with significant clinical consequences. And we think that future efforts should be put into training emergency personnel to both identify and treat tension pneumothorax with a pre-hospital needle decompression. Feel free to let me know if you have any questions, and thank you.